My name is Animwaa Anim-addo, and we'll be here with you until 8 o'clock. Now, if you're wondering why I sound very serious, it's because tonight we're going to have a very serious conversation about plastic surgery. Interesting, yes. So turn up that dial if you're driving. If you're not, then maybe pop over to Facebook. We're live and interactive as always. So it'd be nice to kind of see your comments as we're having the conversation. And of course, send in your questions as well. Our WhatsApp lines are always open, 055-11-11997. So you can send in your questions and then we will answer them as best as we can. And when I say we, of course, I mean my guests, who I just discovered is an old gehiga. But of course, so anyways, yeah. But tonight I'm sitting down with Dr. Zainab Nina Schumacher. She's head of plastic surgery department, University of Ghana Medical Center. Now we're talking to a health professional because I know that we've had a lot of stories about plastic surgery, especially the new trending BBL, the liposuction, the fat injections, and all of those things. And I know that you've heard stories from people who have had those surgeries. But tonight I want to have an informative conversation because I know that there are a lot of women who are considering fixing, changing, adjusting, adding, removing. And so rather than have a speculative conversation, let's have a conversation of facts so that we can, sort of help you make up your mind, help me make up my mind. You never know. So thank you so much for joining us.
Thank you for having me.
Good evening and welcome. It's very nice to meet you.
Thank you.
So, plastic surgery.
Yep.
What's it like in the first place? Like for you, as a female plastic surgeon.
Well, plastic surgery, I'll say it's quite interesting because it's not restricted to one part of the body, actually. Plastic surgery deals from head to toe. And plastic surgery is really not just the cosmetic stuff that people talk about. There's a lot about plastic surgery that is reconstructive surgery, surgery of burns, newborns with congenital problems. So basically, as I say, we are like the surface miners, and we deal normally with soft tissue and skin and soft tissue problems. So as you can imagine, it's from head to toe, and that makes it interesting and diverse because every day is faced with new challenges and new things that we come across. You need to brainstorm to put things together.
Across. How come there are not that many female plastic surgeons? Because when we were looking for you, we kind of had to look, to really find a woman. Is it why is it so?
Well, actually, for surgery in general, we are not very many women as compared to the men. But our faculty is growing, the plastic surgery faculty, and there are more women in training now, and there will be more women coming up soon in the next few years. But currently in Ghana, I think we are 3 or 4 years.
Wow.
Yeah, but we are growing. Don't worry.
Okay.
Smallest time.
Yeah. So, let's zone into what's happening these days. So, a lot more women are opting to have plastic surgery for many different reasons. What are some of the major reasons that you're seeing that women are coming to you for? And does it have something to do more with their insides or more to do with how society is perceiving the body of women as the times have changed?
Well, I'll say it's a bit of both because some people want to have these plastic surgeries for to boost their self-confidence. Some have had children, their bodies have changed over the years, and they kind of miss their old selves. They want to go back to their old selves. But for some people to, depending on the job that they are doing or the work that they are doing, the society perceives you to be a certain kind of way or expects you to be a certain kind of way. So they try to live to these expectations. So that drives them also to have plastic surgery. But a vast majority really just want to boost their self-confidence. They want to look good when they look in front of the mirror in the morning, when they have their bath. They want to look good when they wear their clothes, just to boost their self-confidence. But of course, there's also a good majority of women who come for plastic surgery that is not necessarily cosmetic surgery.
Okay.
For example, they've had breast cancer surgery, so they'll need some form of reconstruction, or they've had some accidents or burns, or they've had some bad scars or trauma. They need some form of reconstructive or plastic surgery. So this category are also there. We see also quite a number.
So tonight's conversation will focus a lot more on the aesthetics, the looks and the but.
Sure.
I also want to take a moment to really just talk about, like, reconstructive surgery, for example, for women who've had breast cancer, or women who have maybe lost a lot of weight and they just have so much skin. Okay. What's the process like? How does somebody come to you, and what does it take? What do they go through to have their bodies put back together? So, for example, if maybe you've had a double mastectomy, what's that like?
Yeah. So, I mean, generally for these kind of patients, before you have any form of surgery, first of all, you need to find a qualified person or a qualified surgeon in a recognized institution, or the right setting, the right hospital or clinic or whatever it is, to assess you. So typically the patient will come, will tell you that I've had ABC, or I'm about to do this, and I'm looking for some form of reconstruction after. So typically you take a good history, and you want to know if they have any other comorbidities, hypertension, diabetes, any other things that could make surgery a challenge. So for patients who have had cancer or undergoing cancer treatments, you also want to know the stage of the cancer treatment they are at, because some people will need some form of radiotherapy, or will have to continue chemotherapy. So you factor that all in when you plan for surgery for these patients. But typically, by the time you operate on the patient, both you and the patient have agreed on what is it that she wants. You've discussed the possible complications, if any. If she has any medical conditions, you've tried to deal with it, to control them, make her safe for surgery before you can have surgery.
So for somebody who has no boobs, how do you build them boobs?
Yes, so for somebody who has no boobs, as in, I'm assuming when you say no boobs, it means she has had like a mastectomy from breast cancer. So for these cases, you build the boobs, so to speak. There are various ways. You can either do that from her own tissue. Typically, we use commonly the abdomen, the lower abdomen, because you see, typically it's like
that's fat.
Exactly. Okay. Or sometimes some tissue from the back, depending on her frame, and also how much volume that the patient might want. But also we can use implants.
Like the silicone?
Yes, the silicone implants. You can use implants to reconstruct, or you can combine both.
Okay.
Yeah, so it all depends on what the patient wants. Yes, and also her medical condition as well. Yeah.
And then if it's for just aesthetics, so if somebody wants a boob job or they want like a breast lift, then is the process the same? I mean, is there a psychological part, like a psychological assessment of somebody before they go?
Of course. I mean, these surgeries for patient that is coming after has had breast surgery from cancer or something. Of course, the psychology will be different from somebody who's just come to say that, I want perkier breasts to look good, etc. This one, the psychology is different. But typically, when you assess the patient. So when you talk to the client, you have an idea of what is motivating this person to have the surgery, because of course you want to know their goals. So it's because some people have unrealistic goals.
Okay.
Yes. So you need to let them know that, hey, this picture that you are coming to show me that you want, it's not a possibility.
Okay.
Or depending on your frame and how you look, maybe this is the best we can do for you. Exactly. And also you want to know, because some people is there that, oh, why is she coming to have her breast done at this time? Maybe is it that the husband has gone for somebody with peckier breasts? So she wanna have,
so she also wants
so typically we discourage surgery in this kind of people.
Okay.
Because we encourage that if you want to have any form of aesthetic surgery, you are doing it for yourself, for you, and not because somebody thinks that, or you feel that your body must look a certain way to please a certain people. And these clients, I must tell you, they are also the most difficult to satisfy.
Yeah,
because they have so much
expectations and the picture that they have in their heads.
Exactly. So we try to always you try to do some form of psychological evaluation yourself. Okay. Yes.
So if I came to you, right? So this is me. So if I came to you and I said I want to look like Beyonce, right? Where will we start from?
First of all,
what are the different options? Should I stand up and turn around?
Oh, please, no.
So now I want to look like Beyonce. Say you've seen her on social media, her renaissance. I want to look like Beyonce. So how do we get there?
Of course, if you want to look like Beyonce, first of all, I would like to say that these body enhancing surgeries or whatever, they are not weight loss surgeries.
Okay.
So there's weight loss that if you want to lose weight, you are coming to do cosmetic surgery. No. So if you come
so we can't do the cosmetic surgery to lose the weight. Like you can't just suck the fat, cut the skin, lift the breast, lift the butt, and then we are good to go. No?
It's not as easy as you think about it, because when you assess patients for these cosmetic surgeries, you are saying cut here, patch here, do that, you have to take into consideration the person's weight that the patient is coming with.
Okay.
And then the height, so which we use to calculate the BMI, which is the body mass index.
Okay.
So of course, the higher the body mass index, it means that this they are associated with more complications.
Okay.
Yes. So typically we advise that you lose weight, and then you are on like a diet regimen.
I'm never going to look like Beyonce, am I? Because I'm sure most people who come to you wanting to change their bodies have maybe tried to lose weight and they can't.
Oh,
so they're looking for
trying to lose weight
an
and
option.
They can't. So yes, he has this fat pouch here, there. Well, you can exercise it, you can suck the fats, you can, try to mold them in a certain kind of way. But you know for sure that the client needs to know for sure that if you come to me and you are, say, a size 16 UK, you shouldn't expect after surgery that you are a size 8 or a size 6.
Okay.
This is not what the surgery is going to do for you.
Okay.
Maybe best case scenario, you might become a 14 or something like that.
Okay. So it's
you
okay.
look
That
better.
one is pushing
so it's like
things.
yes, exactly.
Okay.
It's like to give you a good shape and all, but not to lose weight.
Okay.
Not to lose weight.
So basically, if I wanted to look like Beyonce, then I would have to lose weight first.
Yes. But if you come to say you want to look like Beyonce, then we have to also assess you
psychologically. That why do you want to look?
Exactly.
Okay. What are the most common surgery types that you are seeing these days?
Yeah. So the most common these days are the liposuctions.
Okay.
And then the tummy tuck.
Okay.
Which is, we call the
so can you talk us through that? The
yes,
tummy tuck
and then the transfer. So the tummy tuck, typically what the tummy tuck does is that, so we have
so do I have to lose weight if I have a tummy tuck?
Oh, not necessarily.
Okay, good.
But your results are better.
But it will be either way, it will be better than now.
Of course.
Okay. Okay.
Yeah, so the tummy tuck is essentially to get rid of your excess skin, and also to tighten the abdominal muscles that have separated either from weight gain or from childbirth or whatever procedure it is.
So tummy tuck is skin. It's not removal of fat.
No, the tummy
so those
tuck,
are two different things. Okay.
So when we talk about removal of fat, that's the liposuction.
Liposuction, okay.
That's what we attempt to remove.
Do those two usually go together?
Yes.
Okay.
So commonly you have a combined procedure, because sometimes you want to contour the client properly. You do a bit of liposuction, maybe to the back and the sides, and then you combine it with a tummy tuck.
What's the liposuction like? I've seen the tube thing, and it's sucking and it's going right. But what is it really like? I mean, how does it work? What's
So I mean, like you said, it's really just sucking of fat.
So it's like a vacuum cleaner sort of.
Well, you could look at it in that way. So typically what happens is that you put the patient to sleep or whatever anesthesia that you are using, and then you infiltrate with some solution that will prevent bleeding and also make it easy for the fat to be suctioned. And then you connect your suction and your cannula, and then you suck and you are good to go. But there is some science or in the sucking, because you just don't suck there
randomly.
Exactly. And also the skin has there are layers. For example, if you take the abdomen, we have various layers of fat, so you need to know the layer of fat that you are sucking, otherwise you get complications. So the sucking too, we have different sizes of the tubes, or should I say the cannula, that we use to suck. And so all this is actually aimed at contouring the clients per se. Yeah. So it's, even though it looks just like we are randomly sucking, there's really some science behind the sucking.
Is it painful?
Well, it's talking about pain. Almost every surgical procedure is associated with some pain, but the pain is managed, if I'll say, because we do these procedures under
you haven't said whether it's painful or not.
I cannot say exactly if it's painful or not, in all fairness, because everybody has their different pain thresholds. Yes, but I'll say that's why I said every surgery. I mean, if you have a C-section, there is some pain, but we manage it with pain meds after surgery to make you extremely comfortable until the time when you feel
better. And the recovery time for that?
The recovery time also, it really depends on the individual and the procedure that you've had. So, I mean, all these procedures, if you've had just liposuction, of course, the procedure, the recovery time will be less than if you've had a combined procedure of liposuction and tummy tuck, or you've transferred.
We are taking it step by step so that we. So you remove the fat. Then if you're having a tummy tuck, to remove now the excess skin. I've seen videos of it where they remove that, and then you have to like measure and then put the navel.
Yes,
at
exactly.
A new
so you
place
set the umbilicus. I say you don't put the navel at a new place per se. The navel there
where it is
where it is. But because you've kind of re-draped the skin over there, because you've lifted the skin, you've pulled it down, and then you've trimmed the excess skin or whatever skin that you are taking. So by all means, you will not go with the navel to trim it.
Yeah.
So you need to set it afresh. So we make like a little poke through the new skin that you've pulled down, and then set the navel afresh. It's not
can you have a baby after a tummy tuck?
Yes, you can.
So then you do it, then your stomach could just stretch again. Basically.
Well, of course, but of course your stomach could stretch again if you had a tummy tuck. If you've had a pregnancy, but they don't normally go back to the original pre tummy tuck look or shape that they were
Okay.
before.
So it's not
Pregnancy.
too much of a
Yeah.
problem. Okay, so now we've removed the fat from the stomach. And then now we decide, okay, we want it in some places. So either we want it in that dent in the hips, or we want it in our boobs. Where else can it go? It can go in. Can it go just the fat from your stomach can go anywhere?
Really can go anywhere.
Can you donate it?
No.
Okay, so it has to be
Unfortunately.
used on you.
Yes. Yes.
So it can go your face.
Yeah, if you have some people have sometimes you have some anomalies on the face where you have it's not proportionate. Yeah, you can fat graft the areas that are dipped in, for example.
And boobs?
Yes, people do fat graft
Into the
breast
boob. So you put fat
as well.
into the breast so that
Yes.
it's bigger.
Bigger.
But then is
Yeah.
it firmer? So
not
does that have the same
necessarily.
effect as the implant?
No,
Because the implant makes it firmer.
of course, but the depends on the amount of fat also that you put.
I mean, somebody like me, if you remove stomach from my fat from my stomach,
I can pump your breast.
wow. But so then it would be like it would be perky.
Yes, it will be perky.
Okay,
Exactly.
okay.
But of course, the consistency will not be the same as if you have an implant or you
Okay.
have some other form of reconstruction, either with
Okay.
the tummy
Okay.
or whatever it is.
Do people do breast lifts these days?
Yes.
Okay.
They still do.
What's that
breast
like?
lifts. Yeah. So typically the breast lift really is, as you say, lifting the breast. So it's and it's normally done for a patient that has a drooping, or should I say sagging breast to some
Gravity has won the
extent.
match.
Exactly.
Yeah.
So the breast lift it also gets rid of the excess skin.
So
just
you
like,
lift the breast.
exact in a way, not lift it like how you are holding your hand lift it. But yeah,
You cut like skin and then you lift it too.
yes, but there's a pattern to it all.
Okay.
It doesn't sound, it just sounds so easy, but it doesn't sound, it's not that easy.
Okay.
You need to do some markings, and then you know where you are cutting and where you are excising the excess skin, and then you are really just redraping the breast
Okay.
and getting it
To stand up.
Yeah.
So
That's
is
it.
that less invasive, the breast lift, as opposed to the boob job? And then there's also
when
breast
you
reduction.
you'd say boob job.
I mean, that's the implant.
You are talking about implants.
Yeah.
Of course. I mean, it is less. You are doing less than if you had to do an implant. I mean, you dissect more to put in the implant, and then if you needed to have a reduction, the pattern is similar to a breast lift kind of,
Okay.
because in the breast lift, sometimes we reduce the breast a little bit to get it to look perkier. But with the breast reduction too, it's also more invasive than the
lift.
The lift. Yes.
Okay.
So I'll
Because
say
you're-
maybe the
you're
lift is the
Least.
least of these procedures.
Do any
yeah.
of these procedures affect your ability to breastfeed?
No, it shouldn't. But of course, I'll say the one that could possibly affect breastfeeding might be the breast reduction,
Okay.
and it depends on the kind of reduction that is done, which means that it depends on the breast volume that the patient presents with, because there are some reductions that, I mean, if it's very pendulous breasts to the thigh or to the knee, then you have to do a special kind of
Yeah.
surgery for these patients. With these ones, no, they will not be able to breastfeed. But a breast reduction, all these procedures, if they are done properly, you should be able to
breastfeed.
breastfeed. But I mean, complications do arise. There's a little risk
Okay.
that breastfeeding could
Could.
Yeah.
So are these long surgeries, like I mean, if we're focusing on the breast, the implants, the lifts, are they long? Are they lengthy surgeries?
Oh, they are. If it's just a lift, typically these are not very long. But with the implants and then the reduction, especially, yes, they can take quite a bit of time. 4 to 6 hours.
Okay.
Or even more.
And lipo?
Yeah. The liposuction, it depends on the patient.
Okay.
And how much you are
have
doing.
To remove.
Yes, because if you have a small framed patient, you are just doing minimal liposuction. It might not take as long. But these surgeries, they do take some time, especially it's a combined procedures. Yes, you could be looking at 6 hours, 8 hours.
Wow.
Yeah.
And it's under general anesthesia.
Normally under general anesthesia.
When you say normally, what's the exception?
Yeah, I mean normally under general anesthesia, though some people do some of these. I mean, if you are going to do very minimal liposuction, for example, they sometimes do them under some form of local anesthesia.
Okay.
Or spinal
like
anesthesia.
An epidural.
Yeah, but most of the time
it's
for
general.
Both comfort of the patient and the surgeon and everybody in the room, we normally do under general anesthesia.
Okay, so now we have the fat from the stomach. And we've decided that we're putting some in the boobs, and then we've done the lift. So we've done the upper. So now let's do the lower, because I think a lot of people are interested in the. I mean, in the first place, boob butt ratio. Which one do you find that people are doing more? Are women doing their boobs more or their butts more?
Oh, I would say the butts more.
Oh, why do you think it's like that?
Typically I think people are more guarding of their breasts. And
like as the source of life.
Yeah, probably.
Okay.
So, I mean, with your breast too, you can manage it. You can get a good bra. You can look good out there. Yes, but
even with the butt, you can get silicone.
Yeah, but not everybody wants to wear those silicone shorts.
The silicone shorts. The silicone shorts look like real life bottoxes. If you haven't seen some.
I know, but of course, also not everybody wants to go somewhere.
Because when everything comes off, it will come off as well. Yeah, exactly. When everything comes off, the silicone shorts will come off as well. Okay, so a lot more women are doing their butts. Yeah. Okay, so what's that like? Because we've had a lot of horror stories, seen a lot of things, people who've done implants that have gotten rotten and I mean, so just walk us through the different kinds.
Yeah, so with the butts, commonly, what we do, the common one is the fat transfer. Okay. Or what they call the Brazilian butt lift. So the fat that we've harvested from your liposuction, we prepare it in a certain manner, and then we transfer it to the buttocks area or the hips. Some people are concerned about their hip dips.
So if you lose weight, you lose it?
Yeah, you could. You lose, yes, a bit of it. But also to say that the amount of fat you transfer, as time goes on, you could lose some. It's not 100%. For example, if you transferred 5 liters of fat. Yes, this is typically not all the 5 liters will stay.
Okay, so about how much will stay?
Maybe you could get about 60 to 70%
staying. Okay, so initially it will be bigger, and as time goes by, it will kind of normalize.
And then it will settle. Yes.
Okay, so how does that work? You prepare the fats and then
you transfer it.
How do you transfer?
So we transfer it with a special cannula, and we transfer it. We put it into the so it's a graft. So when I say a graft, it means that this fat that you are taking out is going to survive in the buttocks area from the nourishment, the blood supply from the buttocks area. So you take you harvest the fat, and then you put it in the subcutaneous area. Like, there's quite a bit of fat in the butt. So you put it there, even it out. And you also use it to mold, to contour.
How do you even it out? Like when you squeeze, you inject the fat inside. Then you shake.
Oh.
Or you...
Not the shake like that. But as you are filling it, or
You'll
as you
be
are
seeing- so
filling
you'll
the
be seeing
butt,
the
of
buttocks
course, you'll be seeing it
rising.
rising. So you know that,
Wow.
do I need to inch a little bit more on this side? Do I need to put in? Do I need to balance this side? So yeah, I mean, you get your artistic eye on, and
And
then
then you put it in specific.
and
So
then
the person
you
will be on their
balance.
stomach.
Yes.
So
Yeah,
that you
on their
can get a
stomach,
good
of
view.
course.
And
Yes.
then you. Why is it called a Brazilian butt lift? Like, does it automatically then lift it?
Well, you get a lift.
Okay.
Of course, the butt has become more projection and all.
Okay.
But typically, they call it Brazilian butt lift, because the very first person who did such procedure was a Brazilian.
Okay,
Yes,
okay, that makes sense.
I've forgotten the name, but
Okay.
yeah,
So you put the fat into the butt,
yeah,
and then it lives there happily ever after. It's fine.
hopefully.
Apart from
yes.
what will. And is there any side effects for moving fat from your stomach to your butt?
Normally there shouldn't be.
Why
But-
can't nature like itself move? You just like kind of.
If it was that easy, I would not be sitting here today.
Wow.
If it was that easy, just kind of
Just go here, go here, like go here, go here.
I wish you can talk to fat.
I know, right? So it lives there and it's okay there?
Yes,
There's no-
normally it's okay, but I mean, like I said, every surgical procedure has some possible complications. So after surgery, we normally will nurse you prone for some time, so that you don't put pressure on the butt.
So you can't sit down.
And normally not full flat on the buttocks, like on a hard surface or so. No. So we prefer that you nurse on your stomach. So there are all sorts of things that help. They have what we call the BBL pillows that you can sit on, like very soft stuff, so that you don't put pressure
On your butt.
on the butt.
Because then you could displace the fat.
Yes, also you could displace the fat, you could kill the fat too. That you have to. So at least for about 4 weeks, you want things to settle.
Okay.
And then yeah.
Does it when you do the butt, the injection of the fat, does it displace the internal structure? You know, there's left, right, and then there's middle.
Yes.
So does it shift the middle?
The midline.
Yes.
No, not at all. How will it shift
Are
the
they
midline?
your left cheek and the right cheek are naturally
Yes,
separated?
yes.
They're two
Yes,
separate
it's like
entities.
your left and right breast.
Okay, so it's
Yes.
not one.
No.
Okay, so
Like,
you work on the left and you work on the right,
Yes,
and then
and
you
you
make sure
balance
that
it.
it's
Yes,
balanced.
yes.
So some people don't do the fat injections. Some people do the implants, or
Yes.
like for example, the Kardashians. I think the Kardashians' own is not fat because I remember their doctor who does botched talks about the fat. It's something I don't know what it is that they put inside, and it's $1,000 per injection. Apparently, I need like 10 per butt cheek. So what is it that they put inside when they are not putting the fat?
So for the Kardashians, I can't say what they have put in, but there are other things that they can put in if they are not. So they have silicone implants and they have fillers too.
Okay.
That's
The fillers
you
is
could
made of what?
inject. It's made from a substance, hyaluronic acid.
Okay. I see.
Yes.
It's in other things as well. Isn't it?
Yes, it's in other things as well.
Okay,
It's
so
other
you
things
can
so
put these
typically these are
fillers.
the fillers that's
But why
I use.
can't you just put fat?
It's
Because
a
maybe they don't
patient's
have some.
not even if they have so it's a patient's preference. See, some of the fillers too, they are not they don't live long.
As in they die.
You need to top up after
Top up.
maybe 2 years or so with the fillers. It's not permanent.
Okay.
Yes, but it's less invasive
Than
of course, because
Oh,
imagine that
really?
if you want to do a full
BBL. Then you
first
need
of all
to do
you need
the
to do
lipo.
liposuction, you have to sleep, you have to stack the fat, and then you have to prepare it, you have to push it in. But then with the fillers there, you buy your thing and they inject it for you.
Is it
and
safe,
that's
the
it.
fillers?
Oh, the fillers are also safe if it's done
properly.
Right, by the right person. Yes.
Are they expensive? How much average lipo? If I wanted to do lipo, how much would it be? Please don't say it depends on the amount of fat you're going to suck out. Like, you give me an average.
Oh, the average.
So average lipo.
Hey, this is what you want me to say here today.
I mean, just give us, because there are people who are listening who are saving for lipo for their 40th birthday and things. So please allow them to know. I mean, a bracket figure. It's not me. Lexi, stop looking at my face like that.
Yeah, you know,
a bracket, you know, 50 to 100, 100 to 150.
Oh, that would be very difficult for me to see.
Oh, you are being very, very politically correct.
Political what?
Just give us an idea. Okay, is it expensive?
If it's expensive, it depends on everybody and what they call expensive.
Is it affordable?
Yes, it's affordable, I'll say. I mean,
because everybody's affordable is different.
Of course. For me, I'll say it's affordable.
Okay, let's say I earn 5,000 cedis a month.
Mm-hmm.
And I save 1,000 cedis a month. And I've saved for 2 years. Can I afford to do lipo?
That's a trick question. My maths is not good. I cannot begin to calculate.
No, you need, but we need to have. So let's say I have 20. If I have 24,000 cedis.
No.
I can't do it.
I'll tell you.
Wow. Can't do lipo.
Nah.
Can't do tummy tuck. Can't do BBL. Can't do breast lift.
Yes, exactly. You should use the money to sign up for it.
You can't do any of those things.
Well, I wouldn't say you could. I mean,
you can't. It's okay.
Yeah.
We'll do again. We are going on a break. When we come back, we'll finish this part of the conversation. Then I also want to know if women are doing vaginal rejuvenation as well.
Oh, yes.
They are, yes. So stay tuned. You don't want to miss this part of the conversation.
We've told their stories. It's now time to celebrate and honor their selflessness. It's a moment of recognition and giving these personalities the platform to expand their impact and promote development. They are the finalists of the Joy News Impact Makers Awards. Who among our extraordinary 10 nominees will earn the envious title of the Joy News Impact Maker of the Year? Isaac Ajaoto, Richard Oko, Ellen White or Jefferson Agbotro, Amadou Mohammed, Ilyas Ubaba, Isaka Anesi or Joy Okra. There are also Father Moses Awenonja and John Akaribo. Make a date with us on the 23rd of June 2023, live on your most authoritative and credible news portal, the Joy News Channel, for the live telecast and celebration of the Impact Makers of the Year. The Joy News Impact Makers Awards, celebrating ordinary people doing extraordinary things in their communities.
Joy News Impact Makers Awards is sponsored by KGL Foundation, empowering lives, changing communities, and God Key Properties, building prestige since 1997.
I just got myself a new TV. Wanna watch football or new series. HD plus decoder there for me. I see I'm clear, crystal clear. Quality pictures you can't compare. Feely, 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 feely. Now you dey see I'm feely, 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 feely.
Now you dey see I'm feely, 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 feely. You dey see I'm feely, feely. HD Plus gives you control to search, pause, reverse and record your favorite shows. Now, when you download the My HD Plus app on your mobile and link it to your HD Plus decoder, you get free data to watch TV on the go every month. Visit any multi-TV dealer or Electroland outlet to purchase an HD Plus decoder at a limited offer of 99 Ghana cedis, 99 pesos, and stay in control of your TV viewing. HD Plus, enjoy feely, feely.
The atmosphere is charged for rivalry and fun. Yes,
It's the 12th edition of the Hit FM Rep Your Jersey powered by Bet365. Can Man City win the first ever Champions League trophy, or will Inter Milan grab their 4th title? It's the Citizens versus the Nerazzurris. Wear your favorite club jersey and join us at the Aviation Social Center Saturday 10th of June for the Hit FM Rep Your Jersey. Powered by Bet365, 10 a.m. till you drop. There'll be lots of fun, excitement, entertainment, and amazing prizes to be won. Activities include a Jama Wash and Field contest, sports quiz, five-a-side soccer, and many more. You don't want to miss this entertainment and fun-packed day as we climax and watch the finale of the UEFA Champions League in grand style on a giant screen. Follow us on our social media platforms with the hashtag HitRepYourJersey23. The Hit FM Rep Your Jersey is powered by Bet365, supported by Joy Sports and Joy Prime, and sponsored by Shell Talks Lozenges, Think Natural, Think Shell Talks, Leopard Balm, Fast Action Pain Balm, Nasco, Bring Home Happiness, Heineken, Share the Passion, Jamal Soap, your partner for clean clothes, National Petroleum Authority, Day by Day Man from Dream Cosmetics, Dream It, Live It,
Dashboard International Services, beyond expectations.
Aquadot Natural Mineral Water, Wupenum Anubio, Citizen Sport Mall, Franco Trading Enterprise, Phone Papa Fee, DSTV, feel every moment. Go TV, love it. It's a Hits FM Rep Your Jersey.
So I fell for everything. It held me down, but I got up. Already brushing off the dust. You hear my voice, you hear that sound. Like thunder gonna shake the ground. You held me down.
Welcome back. This is Strong and Sassy here on Joy 99.7. My name's Animwaa Anim-addo, and my co-host, my silent co-host for tonight's show is Lexus Bill. Yeah, he's the one who's coming up with all the questions. It's not me. I'm not like that. So we have Kisat Bekele on the line. We know that she has had surgery, so we just want her perspective before we come back and talk about the vaginal rejuvenation, and then we can also talk about the side effects. But this is not a one show, so we're going to continue next week because we understand that the conversation is very broad. So we'll do that. So let me just speak to Kisa real quick. Hello.
Hello.
Hi. How are you?
I'm fine, thank you. How about you?
I'm very well, thank you. So first of all, let me ask you, was it worth it?
Of course, yes.
Okay, why was it worth it? What makes it worth it for you?
Okay, for me, I had a baby. I was a chubby person before having a baby, and I couldn't tie my tummy. Like the traditional way of how they do it, I didn't do that because I was all alone. So my tummy, I had a flappy skin. It had fallen on my lap, so it was worth it. Now I don't have that anymore.
Okay, so, I mean, how painful was it?
There is nothing, there's no pain I can compare to that. I thought years was more painful, but it's like having 10 years at a go. I didn't have the normal BBL in life what the girls do. I did a mommy makeover, which is a tummy tuck, and it's the repair, the muscle repair.
Okay, so it was a very in-depth, a very deep surgery.
Yeah, very.
So it's called a mommy makeover.
Yes, so it's a tummy tuck with a muscle repair, because ladies that don't have a baby, they just do the tummy tuck for them. But if you're a mother, you have a muscle repair and a tummy tuck. And a muscle repair has to do with the opening up of your tummy and then stitching the diastasis recti. Because the diastasis recti opens up when you have a baby. But the ones that don't have a baby, they just do the tuck, which is just cut the excess skin off.
So what did you do with all the fat from your stomach?
They took it off. They just lipoed it. They liposuction. They just suck it off and then throw it.
Didn't do a fat transfer.
It was just my hips, nothing else, because I already had body.
Okay,
and
so
then I placed some on top of my butt, just the top, so it can raise, nothing else. Yeah.
Oh wow! What was the recovery like? How long did it take you?
By 6 weeks, I was okay. I was moving around.
Okay. So this is just something I'm asking on the side.
Okay.
Does the way people look at you or the way that men look at you, has that changed now that you have the kind of body that you have?
I mean, it's always been like this, and now I'm a mother too. It's still the same, but I don't look at that now. I focus more on my child. In fact, I don't even have a boyfriend. I don't even need one.
Oh, okay. I feel
So
like
I
that's
did
a
not
whole
do my body
conversation.
because of a man.
So sorry, say that again.
I didn't do my body because of a man. I did it because I want to look like who I used to be.
Okay, fair enough. Well, thank you very much.
You're welcome.
We wanted the opinion of somebody who had done it. I feel like we'll love to have you on as well when we have a lot more time, maybe next
Okay,
week, and
fine.
then we can go through what it was like through your eyes and what life has been. Thank you so much for joining us. That's Kitsa. I have not confirmed with her yet, but hopefully we'll have her on next week so that we can, have that conversation. So that sounds like a thing, mommy makeover. It's a lot, eh?
Yeah. Typically, the mommy makeover, usually it includes the breast
As well, okay.
as well as the tummy tuck. or
Everything.
whatever.
Does that include the vaginal rejuvenation? So what's the vaginal rejuvenation? Because it's like right now that the tightening creams and things are not working. So now it has to become a surgical procedure. Or is it a medical thing? Like, is this because people's...
No, I mean, for people who decide to get a vaginal rejuvenation, I don't want to say it's a cosmetic procedure, but it's an aesthetic kind of
It's purely
thing.
aesthetic?
Yeah, unless, of course, there are some people who need it
Okay.
for some reason
No, we're not talking about them.
or the other, yes. But yes, it can be done. It's a relatively simple and short procedure.
How do you do it?
It can be done under spinal anesthesia or
Okay.
local anesthesia, but essentially it just tightens the vaginal orifice. So we
Okay.
have some muscles in there that you tighten. You stitch it in layers, if I should say, just to get the orifice tightened.
So
And
it's
then-
really, vaginal rejuvenation is really just for tightness.
yes, but also
Apart from the medical, those
we
who
have the if I should say, the lips of the vagina that we reduce
Okay,
as well
okay.
to make the place look all so cute and
I mean,
and
do
tight.
looks matter to a man, Lexus? Because
for that one there I can't answer. Yeah, I think he's back. Yeah, I think he's back.
okay, I need to stop. So we're going to push that question to next week. Because we're talking about vaginal rejuvenation and it's an aesthetic thing. Apart from the tightening, it's about So the question is, do looks matter to men? Because I feel like it's an important thing to ask.
Yeah, I'm sure looks do matter because
But most of the time it's dark. What are you looking for?
well, maybe it's not always dark. If
Okay.
I don't know why I'm even answering this question.
No, I think you're just helping me because I can't stop laughing. Okay, so like I said, this is not a one-part show. We'll do it in maybe 2 or 3 weeks. So we'll put together all your questions and then we'll continue. But we have about 5 minutes, so I want to talk about the side effects.
Yeah.
So I mean, it's all fun and
Very
games until it's not fun and games, or until somebody is dead
Yes.
from anesthesia. So what are the side effects? And I mean, generally, in your opinion, I mean, is it really something that we should consider putting our bodies through for the possibility that, you could actually die?
I mean, you can die from anything, from
Yeah.
any surgical procedure. But
something that's not maybe necessary per se. But then
well,
again, what is necessary? I mean,
these surgeries typically they are quite safe. I mean, I cannot emphasize enough how important it is to do these surgeries with a recognized person in a recognized facility.
Okay.
Where you can be taken care of. If there's even a complication, it can be managed. You need qualified anesthesiologist that will put you to sleep and wake you safely. So having said that, some of the common complications are likely to arise. I mean, as in any surgery, you could have some bleeding or infection. But specific to these liposuction and tummy tucks, BBLs, you could have some form of skin necrosis.
Okay.
As in,
so your skin
some
could
parts
die.
of the skin could die from the procedure, or you could have some abscesses in the butt.
Okay.
From the transfer.
Okay.
Of the fat, yes.
Abscesses is like when
infection,
the pus fills the whole.
Yes. It's something that could happen, but it's stuff that doesn't happen.
Like you said, if you go to a good place with a good doctor,
sterile areas, sterile procedure. Normally, you should be up and about.
Okay.
In a couple of weeks.
So I mean, so really, there isn't. It's not a scary thing. I mean, if you want to do it, it's not scary.
No, not at all. Not at all. It's not scary at all. As if you are doing it at the right place.
Oh yeah.
With the right person, go and enter some corner
and do some black markets, plastic surgery or implants.
That one, it could be a bit of a problem.
So in a right place, right doctor, enough research.
Yes.
It should be.
You should be fine.
You should be fine. Wow. Okay. Well, that's our conversation for today. We're going to take down all your questions. I can see you've sent messages. Wow. Jesse said looks matter very, very much to men. Thank you, Jesse. He sends the message from 2 separate phones to emphasize how much looks matter. But we'll continue the conversation next week. And next week, we'll speak to women who have had surgery, what the journey has been like, the ups, the downs, the emotions. Was it worth it financially? Did they achieve what they wanted to do? When you finally look the way you want to, and you step into a room and you have all of the attention on you for your body, is that satisfying? Does your brain get neglected? Do people start to look at you a certain way? I mean, there's so many different angles. So this conversation will continue. Thank you so much for joining us this evening.
Having me.
Had a really great time. And who knows, maybe one of these days I'll come and see you. Even though I say you will make me look like Beyonce. But you never know. So thank you guys for tuning in. It's on Facebook, so you can always go back and watch it if you missed any parts of it. My name is Animwaa Anim-addo. A very big thank you to the team, Mirabelle, Anita, Crispy, Abakes, and to all of you for staying tuned in. We'll be back next week, Wednesday at 7 o'clock. We're handing over now for the 8 o'clock news. Stay safe.